Reputation of this Dallas hospital at the center of this whole Ebola crisis in the U.S. wasn't already, on thin ice. It got worse now. Turns out the hospital has lost a portion of its federal funding actually before. Why? Patient readmissions. Those words should ring a bell because the late Thomas Eric Duncan was the first person diagnosed with Ebola in the U.S. Remember, he went to that hospital initially. He went home and he came back sick with the same thing, readmission. Let me bring in CNN Money's Christina Alessi. And so what is the issue with readmissions at this hospital?
It's actually a huge issue for a lot of hospitals, right? Which is why the Centers for Medicare and Medicaid actually tried to crack down on readmissions by fining hospitals. And Texas Presbyterian had been fined 3 years in a row, right? Not unusual. These fines are relatively small, which is why probably the program isn't as perhaps effective as it should be, right? Because the fines is pretty small. So not a problem from a financial standpoint. What is a problem from a financial standpoint are that patients are too scared to go there. So as a result, the hospital had to shut down its emergency room, a significant source of revenue.
Now, just now, because of all of this?
Because of this.
Yeah.
And not only that, but there are other areas in the hospital that are seeing reductions. And we're hearing that the hospital is has lost 2/3 of its patient capacity.
Correct. That's what Elizabeth Cohen's been reporting. And also quoting the CDC official who spent some 2 weeks at this hospital using the word scared. People are scared now to go to this hospital.
Indeed they are. So the long-term question is, does this hospital eventually have to shut down because of the financial hit it's taking?
Right.
And what is important to point out is that it is actually one part of a much larger system called Texas Health Resources. So this Dallas hospital that was treated the Ebola patient accounts for about 17% of the overall revenue for that parent company. Significant, but the point here is if that hospital, worst case scenario, had to shut down, it wouldn't take down the entire parent company, the one that owns the Dallas property.
I come back to this point. This could have been anywhere. This could have been a hospital anywhere other than these specialty hospitals happen to happen in Dallas. And now look what's happening at the hospital.
It was a hospital in Dallas. It was a Frontier plane. It's a Carnival cruise ship.
Right.
That's what happens in these situations when the unexpected suddenly arrives on your doorstep.
Yeah, and there are significant financial outcomes as a result of this.
Yeah. Christina, thank you. Richard Quest, thanks again.